I'm Julie Bartkey with this Senate update. Last session, the Minnesota legislature passed the Women's Economic Security Act, which provides a variety of protections to working mothers, including an expansion of unpaid maternity leave. This session, some policymakers hope to expand those protections by offering paid family leave. Details were announced on Wednesday in a news conference.
Today, we are publicly launching the Minnesotans for Paid Family Leave campaign. Woo! That's right. We have come together, people of faith, advocates for families and children, and as workers to address the crisis facing working families in Minnesota. So many families do not have access to paid family leave. In fact, in Minnesota, only 14% of families right now have access to paid family leave. And so they are forced to make the impossible choice between caring for the people that they love and providing for their family's basic needs. While people do have access to FMLA, most families in our current economy can't afford to miss those weeks of pay. And it's time that we here in Minnesota make a shared investment in Minnesota's working families so that they can provide for their families and are also free to love and free to care for their families.
That's right.
Today we launch a statewide campaign, a coalition led by the Children's Defense Fund of Minnesota, Isaiah, and the Center for Women in Public Policy, and many other partners. And I want to acknowledge our chief authors of a bill that we are going to be introducing for paid family leave, Representative Ryan Winkler and Senator Katie Sieben. Our bill, yay! Our bill that we are advancing does the following. It creates a state-administered insurance program that gives every employee in Minnesota up to 6 weeks of partial paid leave in the event of a birth, an adoption, or a family medical crisis. Family is defined by us as a parent, a child, a spouse, or a grandparent. Both employees and employers would share in the investment and the reward. Both would contribute 0.1% of the employee's salary into a fund with a cap of $78 per year per employee. This is a common sense solution and would benefit 86% of Minnesota's families.
All right.
Now, you will hear today from the Children's Defense Fund, Minnesota families who would be impacted by this, Faith Perspective, and of course the lead authors of our bill. So I'd like to introduce Peggy Flanagan, the Executive Director of Children's Defense Fund in Minnesota.
Wow. All right.
Good morning. My name is Peggy Flanagan. I'm the Executive Director of Children's Defense Fund Minnesota. I also am the daughter of a mom who I provide caregiving for. I also am the mother of 2-year-old Siobhan, who has a stomach virus today. And lucky enough for us, she would have been here, but lucky for my family, my husband and I have the opportunity to take sick days to care for our child. So Children's Defense Fund's mission includes getting children off to a healthy start in life, and what better way to ensure that than to help parents afford to take the time they need to bond with a new baby or care for a seriously ill child. Parental leave is shown to improve mental and physical health outcomes for new mothers, facilitate involvement of new fathers in their children's lives, and have a positive long-term effect on family economic security. A growing body of evidence shows that children's cognitive and social development may be enhanced when parents have paid leave too. Leave time helps establish attachment between parent and child. It is a major factor in the duration of breastfeeding, which has benefits for both mother and child. And paid family leave helps ensure that parents make it to well baby visits that we know are such critical component of preventive health care. Unfortunately, paid family leave is a luxury afforded by only 14% of Americans. Low-income workers are less likely to have access to leave of any kind, paid or unpaid, than their higher-income counterparts. As an advocate for all children, including the 400,000 plus children living in poor or low economic households in our state, this disparity is cause for concern. It means that children from low-income families face an even steeper ladder to success from the very beginning of their lives. This year's legislature is uniquely focused on early childhood policies, especially those targeted to children in lower income families, because members recognize the importance of those early years in creating a strong foundation that supports a child's future success. Passing the Paid Family Leave Act and thereby allowing parents to take care of their children when they need to, without sacrificing their economic security or fearing the loss of a job, is a significant way that the legislature can help all children, including those growing up in low-income families, getting off to a strong start in life. Thank you.
Now I'd like to introduce Heidi Colt, who is a working caregiver.
Good afternoon. My name is Heidi Colt, and I appreciate the opportunity to share my caregiver experiences with you and why I believe paid family leave is so critically important for caregivers like me. Over the past several years, I have found myself in the role of family caregiver many times. I have had the privilege of being able to take part in caring for my father and my sister, and most recently as the primary caregiver for my mother. My mother was an avid gardener and extremely independent and active person. Unfortunately, in July of 2013, my mother suffered a heart attack and required coronary bypass surgery. Due to a tear from a surgical clamp causing complications during the surgery, her recovery was lengthy and required a 5-week hospital stay and an extended recovery time at home, during which she was unable to care for herself. As a former healthcare worker, I was well aware of the importance of staying on top of her care, and spent many days and nights at the hospital to ensure that my mother was receiving the best care possible. While trying to care for my mother, I was also trying to maintain a full-time job, as it was necessary that my income continue as I'm the sole breadwinner in my household. It quickly became apparent to me that I couldn't continue both responsibilities, and as I needed to be there for my mother, I requested to take family medical leave. I was fortunate. Due to the personnel policies and support of my employer, which allowed coworkers to donate PTO time to me, I was able to receive over a month of donated PTO time. This, along with the PTO I had in place, allowed me to cover all but 2 weeks of my leave. I know that without the donations from my supportive coworkers, I would not have been able to make my mortgage payments or meet my other household expenses. Even with just 2 weeks without pay, I had to extend the payment on all of my utility bills till months later. Because of the generosity of my coworkers, the stress of worrying about my income was lessened. But what if others aren't as lucky as I am? It's unfortunate that we have to gamble on the goodwill and charity of others to make it possible to care for our loved ones when they're seriously ill. I'm happy to say that these days my 87-year-old mother is back to her independent and active self and cannot wait to start digging and planting in her gardens as soon as the weather allows. I firmly believe that without the care I was able to give my mother during her illness, she would not be where she is today, and quite possibly not here at all. My hope would be that all workers be afforded the opportunity to take time off of work for a loved one, as I was, without the additional stress of worrying about paying bills or keeping their homes. And as I know I will most likely be a caregiver again in the future, I hope this kind of protection is in place for me, as no one should ever have to live with making a choice between paying their bills or sacrificing their loved one's well-being. Thank you.
Thank you.
Nikki Kleman, who is a working mother and a momcologist.
Would you mind spelling your name for us, please?
First, Nikki, N-I-K-K-I, Kleman, K-L-E-M-A-N. Can everybody see me? Okay. So my name is Nikki Kleman. I'm here today as a mom who knows firsthand how important paid leave is, paid family leave is. My husband and I have 3 children, a 5-year-old daughter and 3-year-old twin boys. Our son Mason was diagnosed with acute lymphoblastic leukemia shortly after his 2nd birthday. He was hospitalized and then homebound for almost 2 months. The only time he was able to leave the home was for doctor's appointments, bone marrow biopsies, chemotherapy treatments, and hospital stays. Due to treatment, he's left with no immune system, which means that sometimes he can't be in a daycare setting, and there's automatic ER visits for a temperature over 100.4 degrees. Last year, I was introduced to Momcology, a support community for mothers of children who have been diagnosed with cancer. and was lucky enough to attend their first national retreat. I formed relationships with moms whose kids were diagnosed with cancer or leukemias, and time and again I heard heartbreaking stories of parents who were financially devastated by their child's illness. They lost their homes, their insurance, and gave up everything to take care of their child. On top of the medical bills, many parents have to miss pay that their families desperately need to be with their kids through hospitalizations, procedures, and recovery. I've also heard from parents who were fired who have had to quit their jobs because their employers would or could not give them the time they needed to take care of their kids. At this retreat is where I met Teresa Nace. Her daughter Adeline was diagnosed with retinoblastoma at just 9 months old. She wasn't able to return to daycare until her 6 to 7 months of treatment was completed. Teresa became her full-time caregiver, and the medical bills started piling up. When Adeline was able to return to daycare, Teresa was able to get a new job. Adeline became sick shortly after, and Teresa asked for some time off of work. Her new employer told her, "If you were more senior, we could help you with your child who has cancer. We can't help you at this time." Teresa was not yet qualified for FMLA and worried she would lose her job if she took time off for her doctor's appointments or hospital stays for her children. There's currently no protection for situations like Teresa's, and the system is failing those who need it the most. Another mom, Kelly Green, has also encountered difficulties with her employer. Because she has missed work because of her son's cancer, she's being pressured to cut her hours from full-time to part-time, which would cause her family to lose their insurance coverage. As a single mom of 2 boys, including 14-year-old Jacob, who was recently diagnosed with rhabdomyosarcoma, she would be left with no income and no insurance. With radiation treatments averaging $29,000 per treatment, she would financially be ruined. So as parents and primary commitment is to protect and care for our children. We should not be forced into making impossible choices between earning money for our families that they need to survive and caring for our children as they face life-threatening illnesses. That's why we are working to pass paid family leave so working parents have the support they need to take care of their families. Thank you.
For a faith response, or how people of faith are called to respond to this issue, I'd like to introduce Pastor Amy Jo Burr from Good Samaritan United Methodist Church in St. Peter, Minnesota, and she is also the pastor of the United Methodist Church in Le Center, Minnesota.
Would you spell your name?
Burr, B-U-R. I speak today to remind us of the values that bind us together as people of faith. As people of faith, God calls us to love abundantly, the way God loves us. And the way that God loves us is as family. When we begin our prayers with common language like Our Father or loving God, Mother and Father of us all, we're calling on a God who teaches us by example how to love family with abundance. In God's family, we share a belief that every person of every age is made in the very image of God. And in God's family, we also share a value that the most vulnerable amongst us is the most beloved, that God cares especially for those who are hurting, for those who are sick, for those who are lonely, for those who are oppressed, and so do we. When we care for our loved ones through the crisis of sickness, through the frailty of the end of life, and through the joy of childbirth, we're loving our families as God has taught us to love our families. As people of faith, we're dedicated to creating an economy that nurtures every person and allows them to live and love abundantly. As a mother, I was blessed with paid family leave after the birth of both of my children, so I could take those babies home and surround them with loving care. But I am grieved to tell you that is not currently the case for many Minnesotans. Currently, thousands of Minnesotans without paid family leave are being faced with the impossible choice of either caring for loved ones or going to work to make the mortgage payment and the medical bills. As a pastor, I often visit in the hospital rooms of parishioners whose family have been at their bedside all through the night and then go to work sleepless because they do not have the option of missing a paycheck. We can change this, beginning by passing a paid family leave policy so that Minnesotans will not be forced to choose between caring for their families and working to provide for our basic needs. Together, people of faith can build God's economy where all people are able to live and to love abundantly. Amen.
Amen. Now I'd like to introduce Representative Ryan Winkler and Senator Katie Sieben. I'm not sure which order you want to go in.
Go up together.
We'll go up together.
Sure. Or am I supposed to go first?
It doesn't matter.
Okay. Do you need a spelling bill, or are we good?
I think we're good.
Okay. We're here. We are both of us very proud to sponsor this legislation today. Paid family leave is about all of us in Minnesota. It's about the voices that you've heard from today. It's about family members who need the care that we're talking about. It's also about a stronger economy and an economy that values the input and the contribution of workers. This bill represents an opportunity for businesses to provide paid family leave to all their employees, not just a few. 14% of Minnesota workers today have access to some kind of paid family leave, more than 20 years after Congress first created the Family and Medical Leave Act. So we're talking about an issue that has been a long time in coming. We're talking about an issue that affects almost all Minnesota families, and we're talking about an issue that if we don't take action on it, we will continue to tell people that their value and their contribution in the workplace is less if they have a family member who is sick, a new baby, or someone that they need to take care of because of age. So I think the important part of this bill today is signaling that Minnesota families have been taking care of loved ones for a long time. Our workplace has changed. The nature of our working lives has changed. We don't have a caregiver staying at home anymore in most families. And so our workplace policies need to be updated to the modern reality that workers and families are facing. So we're proud to sponsor this legislation, and I think we can get action moving this year.
To build on what Representative Winkler said, I think it's important to point out that Minnesota has the highest participation rate of women in the workforce of any state in the country. And so this is why Minnesota needs to help lead the country in enacting paid leave that's paid for by the employee, but also by the employer. There's nothing more important in a individual's life, I don't think, than at the dawn of birth or at the end of life. And that's really what this bill is about, being able to take care of a new family member, whether through a birth or an adoption, and then in many cases being able to take care of a family member at the end of life, such as a parent who may be dying. And so I think that we will find strong support in the Minnesota Senate and in the legislature this session for this proposal. We had great success with many of the people that are here passing the Women's Economic Security Act last session. And one of the key provisions that we're all proud of was that there are new protections in Minnesota law now for pregnant women. This is taking that great work that we did last session one step further. So I look forward to working with my co-authors in the Senate, who include Senator Rest, Senator Bach, Senator Herr, as well as with Representative Winkler and the many supporters he has in the House to see this bill become law in Minnesota this session.
And one last thing, I should also recognize Representative John Lesch, Representative Jennifer Schultz, and Dave Pinto, all of whom are going to be helping on this bill and others, and Representative Lesch in particular on earned safe and sick leave, which is another important component of a initiative that we're going to be pushing this year to make sure that working parents and working families have access to the basic job protections they need to take care of themselves, take care of their families, and stay working.
So now we will take questions, if there are any questions.
Representative Winkler, curious, Have you had any conversations with the Minnesota Chamber about this, or just generally, do you have a feel for the business community's attitude toward this?
I yesterday had a brief conversation with Charlie Weaver of the Business Partnership about this. I have to say he was initially hesitant, but when we talked about the way the bill actually worked and about the fact that many of the largest employers in Minnesota that the Business Partnership represents offer some form of leave to some of its typically more senior employees, and this would actually help offset some of those costs, I think he was a little bit more open to the conversation. So we're hopeful that we can recognize and get recognition from business groups that this is actually something that helps the economy and helps them attract and retain quality workers. And in fact, we know that when people have access to some kind of paid leave, they're much more likely to actually return to work after they are out of work to take care of a family member. So we think there are economic benefits, and we hope to talk about that some more with them.
And what do you see the prospectus as of attracting enough Republican support in your chamber?
Well, a bill like this kind of policy, has something like 94% support from Democrats, 80% support from independents, and 64% support from Republicans. So this is legislation that is overwhelmingly popular with the public and not just one party. And I'm hoping that Republicans will see the value in doing this for their constituents, for plenty of people in their party, and people who are working all over the state. And it is a moral question, and it's a family values question. And I would hope that Republicans see the value in this kind of proposal.
Yeah.
But to follow up on Bill's question, right now they're just Democrats on your bill. I mean, have you had conversations? Have you had some indication that this has a chance of going someplace with the...
Representative Garofalo, the chair of the Jobs Committee in the House, did indicate he would give the bill a hearing. So at least we've taken that initial step. We'll see if we can move it along. And you know, this paid family leave concept is not something that Republican legislators are very well familiar with. So I'm hoping that as we get this campaign started and folks in their communities speak out and let them know that these are things that really matter in their communities, as they hear from churches and all kinds of folks, I hope that the education campaign helps move them along as well.
Is there an estimate for the cost to employers?
The total, it's capped at $78 a year per employee, which is split between employers and employees.
Okay.
So the employer would be responsible for half of that maximum.
Yes.
Half of 78.
Yes. You want more specific? We can get. No? Okay.
If there are more specific policy questions, we can also invite Deb Fitzpatrick from the Women's Center on Public Policy to go deeper into the bill. Are there any other policy questions?
Okay, so just so we're clear, though, the $78 a year, I just want to be sure I understand Representative correctly.
Yes.
$78 a year, half of it cap, half would be paid by the employee, half by the employer.
That's not quite correct.
No?
I'm going to have Deb clarify this, yes. I'll make sure that's absolutely correct. Yes.
So, yeah, I'm Deb Fitzpatrick. I direct the Center on Women in Public Policy at the University of Minnesota. And it's $78 for the employer and $78 for the employee. So it's 0.1% up to a maximum of $78. So if a person earns $50,000, it's $50, and the employer contribution matches that. So it's another $50. Yeah, on average.
So what's the average?
Well, the average median earning for average Minnesotans, $34,000. So it's about, you know, the average would be $34 contribution from an employee and $34 from the employer. The estimated overall cost of the program is around $93 million per year. And so that cost would be split between employers and employees under the tax.
Okay, so when everything is in, $78 cap for when everything's in total, it would be $93 million about.
Right.
Okay, so about half of that paid by employers.
Right. But I can give you an example, like even for a small business, if you kind of do the math, if you had a small employer that was earning had maybe 5 employees earning $50,000 each a year, so they had a total payroll of around $250,000 a year. If they had just one employee take that leave in a 15-year period, their investment would be recouped. So, you know, it does really have a potential strong benefit to employers, particularly small employers who would have a hard time sort of being able to pay for that benefit by themselves.
What do you mean their investment would be recouped?
So in other words, if so otherwise they would be contributing $250 per year to have their entire 5 employees covered. And if you assume that that's over a 15-year period, the investment that they would put in, that $250 for that year, that many years. They had one employee take the six weeks of leave over that time frame. That would basically be a wash in cost.
They get it back.
They get it back, right? Exactly.